Today marks International Fetal Alcohol Spectrum Disorders Awareness Day. According to the World Health Organization, South Africa has the highest recorded FASD prevalence rate in the world. It's estimated that the country's overall rate is at least 6%. Now, there is no treatment for FASD, but it can be prevented if women do not drink during pregnancy. To tell us more, we are now joined via Zoom by Gareth Carter, internationally accredited Addictions Counsellor for Changes Addiction Rehab, who's been treating patients in SA and the UK for the past 25 years. Gareth, good morning to you. Thank you so much for speaking to us. This is really a big problem here in South Africa, and perhaps we can talk about why, what are the factors that influence why we have such large numbers. But for those that really don't know, what are the dangers of women drinking while pregnant?
Well, on the less severe end of the spectrum, which most people are quite surprised by, it only takes around 16 drinks within the first 6 or 7 weeks of pregnancy for the baby to suffer things like attention and hyperactivity disorder, perhaps some anxiety and depression. It really is a severe problem because it takes 4 to 6 weeks for the woman to realize she's pregnant. And in that time, she might have had the 16 drinks, which equates to about 2.2 or 2.5 drinks a week. It's really not a huge amount of alcohol, and yet the consequences can be quite severe.
I mean, that's really concerning, right? And I wonder, what needs to be done from an education point of view. But let's quickly just set the tone here. The highest rate of fetal alcohol spectrum disorder in the world. I mean, what are we doing wrong as a country?
Well, I think there's a myriad of different things going on. And, this FASD and the problem is particularly high in the Northern Cape and the Western Cape. And they think it's a throwback to the old DOP system where wine farm workers were paid in wine instead of in money. And so that was about 200 years ago. They think that was the start of it. And I think it's a multifaceted, difficult problem to address because the FASDs are entirely preventable if the baby's not exposed to alcohol before birth. Most of the damage takes place in the first 3 months. But here in South Africa, we have such a smorgasbord, such a plethora of difficult, complex problems. And we had 102,000 people die of the COVID pandemic, yet there are 6.5 million people affected by FASDs in the country. And for me, addiction and mental health is the real pandemic. So we have 55,000 children living in child-headed households. We have more than 1/3 of children in Gauteng, the province that has the continent's richest city, Joburg. More than 1/3 of the children in this town are quite literally starving. They're physically stunted. We have 115 rapes a day. Our gender-based violence is 5 times the world norm. Our drug and alcohol abuse is twice the world norm. And what ties all of these together for me is addiction and its effective treatment. If we don't have whole-scale public health, easily accessible treatment for people that have chemical dependency problems, these issues are only going to exacerbate across time and get worse and worse. So it affects crime, families, public health, people's ability to work. So the country's GDP, it really is a difficult problem.
Yeah, I think we've talked a lot about fetal alcohol syndrome in the country and now fetal alcohol spectrum disorders. But I wonder if South Africans actually know what these disorders do to the child, right? What is the impact of drinking on the child? What happens throughout the development of that child?
Well, a lot of the symptoms only appear when the kid goes to school and learning difficulties appear. It's only the most extreme cases that from birth you can see how the child is physically different. And some of those extremities can actually be internal organ damage. They have trouble hearing and seeing, their memory and attention. Sorry, I've got some guy speaking to me in the background there. I don't know if you can cut him off.
Okay, can we get that out of his ear? Go on, Gareth.
Some of the difficulties can be as mild, if I can use that word, as attention deficit disorder, some anxiety and depression, quite mild, all the way up to internal organ damage. And they have quite wide and narrow eyes and a much smaller head on their body. So these children, and you mentioned a rate of about 6.2%, I think.
Right.
We really don't know. We guesstimate it's anywhere between 6.2 and 11%. So
Sure.
111 children per 1,000 in this country are born with FAS or FASD symptoms. In some communities in the Western Cape, it's up to 72%. So it really is severe. If we don't address this, guys, there's 6.5 million people affected by this. That's 10% of our population. If we don't deal with this, where do you think we're going to be in 10 years' time or 20 years' time? Kids with FAS are 19 times more likely to end up in jail. In the UK, one study revealed that it cost £2.9 million, which is just under 60 million rand, to see one FAS kid through its lifetime, to ensure it has the care and the developmental support it needs throughout its lifetime. 60 million rand. We don't have this kind of resources. We don't have that kind of money.
Right.
We have to get down to the root causes and conditions and deal with this problem from there, which is mental health and addiction.
Yeah.
That's the true pandemic.
Yeah, Gareth, you're painting quite a picture there for us, but thank you so much for that sobering discussion. Gareth Carter speaking to us there, a counsellor talking to us about fetal alcohol syndrome and really why we need to protect our babies, particularly women while pregnant.